there are also more important serious use cases, right? Like risk prediction and sepsis detection. And how is like AI being used in those cases, like where
I think
can
that's
be a
a
life
whole
and death
new
issue?
area of
Yeah.
predictive AI, right?
Right.
Which has been around longer, in my opinion, than generative AI. So we have more
Right.
experience with it. And
Right.
that is where I think, you know, we need to think a little bit sort of deeply around
Mm,
the risks surrounding it, right? So
right.
yeah, we deploy a lot of AI into clinical care, but I
Mm,
think that like the decision to not deploy something is equally important as a decision to deploy it, right?
mhm,
What do
mhm.
I mean by that? If as a physician I make a mistake just because of the bandwidth and like the number of patients I see is going to be limited to like a patient or five patients at the most, right? If an
Right.
algorithm is inaccurate, then it scales to like tens of thousands of patients, right?
Yeah.
I think that is where you sort of need assurance, you need monitoring, you need privacy, and you need security. And ideally, you need one level above that, which is sort of randomized testing or
Yeah.
some sort of AI assurance where you
Yeah.
put things through like an A/B test, obviously with highest levels of patient security, etc. And then you put that into clinical care. Now, that being said, at Mount Sinai, we've deployed several of these predictive AI algorithms for
Mm,
things like worsening of kidney function, prediction of
yeah.
malnutrition, prediction of falls, etc., etc.
Mm,
Now, a lot of them are monitored continuously to allow for drift, etc., etc. We want to make sure that those are anything that sort of makes is patient as not patient facing anything that impacts clinical care as we know it is safe, effective, and ethical.